Okay, so I'm super excited to bring this specific subject to you because I think it's one of the more complex conditions or diseases, whatever you want to call it. And a lot of people get very confused on how to go about looking after their patients that are diagnosed with Lyme disease or have Lyme disease. And it's about really this title. It's about understanding the pathophysiology of Lyme disease and how to effectively assess and treat Lyme disease. And really, what I've tried to do is to simplify this down so there is a way for you to understand the process by going backwards, understanding that pathophysiology, what is Lyme disease, how does it disrupt the systems as far as us understanding the functional medicine algorithm and the matrix, how all the systems work together. And then what are the best methods to move forward to assess, and then how do we treat in the understanding of all of that as we put it together. So let's just start first of all with the basics and just have a look at the incidence of Lyme disease. And here you can see over the last 3 decades, it's just gradually going up and up. And yeah, maybe it's one of the cases is that we're more aware of it, we're understanding it, we're understanding how to assess it better. And maybe that's part of that whole process of the incidence just rising and rising. So let's look at the life cycle, and I don't want to spend too much time here, but I want you to understand that this Borrelia that is inborn in a tick goes through this cycle of living on many different animals and infesting or biting a human at some stage and infesting them, and then creating this infestation of Borrelia, which there can be many different types, and offsetting the cascade that goes on from there. So that's just the basis there. The next thing is to understand that there are many different ticks out there. And there are certain ticks that will carry certain of these Borrelia along. And it's important to know that not all of them do it, and there's different incidents in different areas of the country and the world. And this is, again, just a slide going through that, yeah, Borrelia burgdorferi, which is the most common one associated with Lyme disease, is not to be said that that's the only tick-borne infection out there. And we've got to be aware that there's many others, and there is well-documented conditions that these others do create, like tick-borne relapsing fever, like acute febrile illness, bovine borreliosis, and so on. So yeah, we're going to be focusing on a little bit here of Burgdorferi, particularly with Lyme disease, but just understand that this is far more complex and far more diverse than just bringing it down to that one species. Looking at the incidence here of all of those different tick-borne diseases, we can certainly see with Lyme disease how it is concentrated in that northeastern area, but it is scattered. All those purple dots are the Lyme disease concentrated areas, and they are scattered around the country. Yeah, it may go according to the population concentration in one aspect as well, but we do know that the predominance is more in that northeast section of the US. And here again is just a disease reported cases in the last almost 3 decades. And again, you can just see how that previous slide correlates very well with the incidence here in that northeast area and the colder climates. Although you are seeing down in Florida, Texas, California, there's a higher incidence in those areas as well. So maybe closer to those coastline areas or water areas. So interesting facts just to know. And this is a great graphic as well, with this big emphasis of, did Lyme disease all originate from Plum Island, because the incidence is so high there, and it's worked its way outwards from there. So yeah, that's an interesting theory. and certainly one to consider. So let's get on to more just what does Borrelia burgdorferi look like and what are the different shapes and forms that it takes form. And it's important to know that it has this active form and can transform right through to a cyst form, which you can see in the bottom right side. And that is important for its evolution, its survival, to be able to transform into these different body forms to protect itself, to hibernate in a way, to hide away. And we're going to go through exactly those characteristics. But it's important to just understand that it can take these different shapes and it can morph along, as you can see from top left down towards the bottom right, into the cyst formation. So erythema migrans, obviously that is the most common clinical symptom to say, yes, okay, we've got a tick-infected case here, and it is more than likely Lyme disease, and we need to do something about it. It can come or present itself in many different ways, as you can see in the pictures here. But the most important thing to remember is only 20 to 40% of tick-infected cases see, let's say they visually actually see erythema migrans. And yeah, maybe it occurred, they didn't see it, or was very restricted, very small, and it went away very quickly, whatever that may be. But the reported case is only 20 to 40%. So it can't be conclusive for us if somebody says, well, they've never had erythema migrans, so I don't have Lyme disease, because the majority of the possibility is they have. And that is where the trick comes in understanding everything else. So let's have a look at the classic Lyme disease symptoms. And these certainly aren't something that is conclusive. Again, flu-like symptoms, multi-system involvement, arthralgias, occipital headaches, neck stiffness, fatigue, bullseye, ringing in the ears, muscle cramps and spasms, palpitations, neuropathy, burning, tingling, blurry vision, mood swings, anxiety, depression. And there are just so many clinical signs and symptoms. Let me go back to that and just go through those again, because there are so many, and this is where the confusion really comes in, is that all those clinical findings are sufficient to tell us many different possibilities of conditions that may be out there. And one of the big tricky ones is these are very similar to mold. And the similarities are very difficult to distinguish with a person that presents with all those. So that is what is so difficult. So the clinical findings alone are not sufficient just from the erythema migrans to say, yeah, this is definitely Lyme disease. And that is why we have to look at everything else that is manifesting and then dig deeper beyond that to look at certain specialized lab tests that we can, again, try and confirm a Lyme disease. And this, again, is just bringing the complexity of Lyme disease into perspective, that it isn't something that is so definitive in its ability to be diagnosed. And that is half the problem, is people are misdiagnosed, mistreated, and the difficulty in just moving one step forward in a functional medicine type of acronym that we know through the Go To It can be difficult in just bringing all these things together. And this is the overlapping symptoms that I was talking about just between Lyme, mold, and multi-chemical sensitivities, is they are so similar. And the only difference here, and that's for 20 to 40% of the Lyme conditions, is that erythema migrans rash. Otherwise, they are all the same symptoms moving through Lyme, mold, and multi-chemical sensitivity. So that is the tricky part here. So this is just interesting to see that this one study showed that 100% of the Alzheimer's brains brought into autopsy had Lyme, had Borrelia in it. And yeah, I mean, those spirochetes can be so destructive from an immune point of view that no wonder there are so many plaques in those Alzheimer's brains. So maybe there is this big association, and we need to just keep that in mind as we move along. So and I've put this talk together a little bit backwards, I want to go through all these clinical signs and symptoms, why patients don't get better, and then I want to go through the pathophysiology, because I wanted to make a little bit more sense from a functional medicine perspective on the systems approach. So let's have a look, and this is from the book Why Can't I Get Better by Richard Horowitz, and we know he's one of the gurus when it comes to Lyme. And the number one reason that Lyme patients don't get well is they have multiple co-infections that have not been successfully identified and eradicated. And that is part of the Lyme's pathophysiology. So when we get to that, I want you to remember this point, because it's so important to actually understand how Borrelia creates this immune dysfunction to allow other co-infections to coexist and to evade the immune system and create dysfunction. Then number two is there's just complete autoimmune disruption. Immune dysfunction, autoimmunity, immune deficiency, whatever it may be, the immune system is a mess. Inflammation, well, if there's immune dysfunction, inflammation is going to be off the scales, and the inflammatory response has not been calmed down. And you'll see when we're going into the treatment protocols, this is one big area that we've got to emphasize. Otherwise, if this is continue to have this cascade that's upregulated, you're just going to have frequently triggered infections and toxins and chronic pain. Next one is toxicity. And again, we have to address just this point if we want Lyme patients to get better on the whole from that functional medicine perspective. So toxicity, heavy metals, environmental illness, mold, mycotoxins, they're all going to be part of one. Sometimes we can't separate out the two and say, this is Lyme, this is a mold case. Sometimes they're coexisting, and that can be part of the difficulty. Allergies and sensitivities. Yeah, I mean, from food sensitivities, histamine reactions, those are all going to be upregulated if you've got an immune system that's disrupted. Inflammation's higher, we're full of toxicity. Naturally, we're just going to have this immune system as far as sensitivity and allergies on a heightened level. What's very interesting as we go through this Lyme talk is the nutritional and enzyme deficiencies that can occur because of these immune dysfunction characteristics that Borrelia brings with it, and the consumption of what Borrelia eats on itself, creating further nutritional deficiencies, and with these deficiencies creating this cascade of events that just create a vicious cycle. Mitochondrial dysfunction, we're going to dig a little bit deeper into that. Psychological dysfunctions, and we can imagine once we have this immune dysfunction, how it disrupts the gut, and we're going to have this gut-brain axis. If we've got all this inflammation in the brain, where the Alzheimer's have all been associated with spirochetes, no wonder there is these psychological dysfunctions when it comes to Lyme, and we see this with pediatrics as well. Neurological dysfunction, well, we've just gone into that. Endocrine disorders, the immune system, the hormonal system is going to be a mess if the body is just under attack as such. Its immune system has been disrupted. The hormones are going to be completely disrupted as well. So if you don't get on top of the hormones, again, nothing is going to come right. Sleep disturbances, autonomic dysfunction, GI disorders, liver dysfunction, and pain. And they tend to all, as you understand functional medicine so much better now, you're understanding how these are all just linking together, and it's a vicious cascade in deconditioning. So let's have a look at some of the classic pediatric Lyme symptoms. And delayed speech, decreased attention and focus, decreased receptive language, decreased auditory processing, outbursts, impulsivity, particularly if it's out of the norm. And a lot of this is if there has been a disruption in the normal timeline. So speech has been going fine, and then all of a sudden there is a hiccup. or attention and focus was great, and then all of a sudden there's something that has been away from the normal upscale or exponential growth in the child's normal development. So think about all of those from a timeline perspective. Short-term memory affected, difficulty with abstract reasoning, mood swings. That can be a big one if they've been so stable all along, and then all of a sudden they're having these outbursts, these mood swings, they're depressed for no apparent reason. Sensitivity to light and sound, and that's a big one when it comes to just a mitochondrial dysfunction, when that light and sound is just too much for them to bear. Fatigue, if they've been bouncing off the walls forever and now all of a sudden they can't get out of bed and they want to go to bed, 6 a.m., which no kids really want to do. They want to be going to bed or 6 p.m., they want to be going to bed at 10 p.m., 11 p.m. Then you've got to be thinking, okay, what is going on? Sleep disturbances, new onset bedwetting, if that is something that's now new, that's stress of the body. Arthritis, joint pains, particularly if they're moving around. Abdominal pain, nausea, diarrhea, chest pains, palpitations, headaches, stiff neck. All of those can be massive red flags to just bring together while you're assessing the patient to say this could be a possibility of Lyme. And we've seen this with many pediatric patients that we've been working with our practitioners and with ourselves, where we've started the protocol and then there just hasn't been the progress that there should be. So they've started with a gut protocol. They've had, these psychological, or I wouldn't say psychological, but say short-term deficits, not focusing, wetting bed, those type of things. And then we've started with the normal functional medicine protocol, and then they just don't progress, they don't get better. And then we've got to look deeper and say, okay, this may be a case where there is Lyme, and go from there. So sometimes the picture isn't clear in the beginning, and then as you move along with a protocol that usually gets great results, and you stumble, you come to a point that they're plateauing, they're not getting better, then you've got to think at the higher level. And you got to start thinking things like Lyme, mold, and so on. So let's go into some things that happen with Lyme. And this is why I want to go into the pathophysiology of Lyme disease now, so that you can understand all those clinical signs and symptoms. So that's why I've switched this around. And the first obvious thing to think about is 1,500 genes these spirochetes have. That is massive if you think about it. So there's at least 132 functioning genes, and just to put it into perspective, things like syphilis has got 22 functional genes, and that's incredibly difficult to suppress. So now you've got something with a lot of sophistication from a genetic point of view, and this is half the reason why it has the ability to create so much dysfunction in the immune system, because it has this level of intelligence. So it has this unusual genetic makeup where they say it's not circular, but it's linear. And they have 21 plasmids, which is 3 times more than any other bacteria. So it really is something quite unique, quite different. And we've got to bear that in mind when we start having a look at this pathophysiology of Lyme disease. So what they like to call it is stealth pathology. And this is what they believe Borrelia burgdorferi uses to engage, to evade the human immune response. So stealth means sneakiness, and this is a great way just to kind of think about this spirochete. Is it sneaky? And it's all about when you do something with stealth, you do it so quietly and carefully that no one notices, and then all of a sudden the body's a mess. And doesn't that just sound so typical with so many of the Lyme cases? And it really is something to take your hat off to, how these little creatures are able to get into our body and just disrupt the immune system in this way. So stealth pathology really involves 4 basic strategies. So this is important to understand and just to understand the complexity of this little spirochete. First of all, it has the ability of immunosuppression. And that would make sense. If it's just disrupting the immune system the way it does, it's going to have some ability to do that. It has this genetic phase and antigenic variation. And then it has the ability to create physical seclusion. And we'll discuss that a little bit now. And then it has secreted factors. So let's go into those four now so you can understand this a bit more. So let's look at that first one, the immunosuppression. And this is a little bit of both. So it's the Borrelia and it's the tick. First of all, the tick saliva contains analgesics, anticoagulants, and immunosuppressive factors. And they're expressed into the wound. So when that tick bites you, it's allowing that spirochete to then penetrate the skin. So it has this relationship with the tick as part of its symbiotic relationship. And that helps that spirochete to evade the local immune response because of the saliva from the tick. So very, very clever how that's all happened. So let's have a look then at Bergdorf area. It also induces, at the same time as the tick has induced its little response in the saliva, the Borrelia also produces immunosuppression by a complement inhibition and the induction of inhibitory cytokines, such as IL-10. So it's saying, okay, I'm expecting this, so I'm going to secrete something that just blocks that and counteracts it. And it's doing that from the complement cascade, and it's doing it from the inflammatory cascade to be able to just suppress our whole system. Now, obviously, with the erythema migraines, there is a reaction with some people to a certain degree, but it's not enough to destroy that bacteria, to destroy the spirochete and allow it to penetrate further. So it also induces monocyte and lymphocyte tolerization and antibody sequestration in immune complexes and all mechanisms of evading the immune response. So it's just highly, highly intelligent into how it's gone through this process to develop these strategies to get into the body. So it has many characteristics to survive and thrive, and that's really the key. Here it has this genetic phase and antigenic variation where it has genetic switching, which is similar to trypanosomes. It has the mutation and recombination, which is typical of HIV virus. And then it has the variable antigen expression, which is similar to Neisseria species. And then the autoinduction of dormant organisms, which occurs in mycobacterial infections. So again, a highly sophisticated way to just get in and disrupt. And then the final one is the fibronectin binding, as with staphylococcal and streptococcal infections. So it's taken this multitude of characteristics from this genetic phase and antigenic variations and used all of those combinations to be able to survive and thrive in us as a host. And then it has been shown that the neutrophil calprotectin can induce a dormant cyst state in the spirochete, allowing it to persist in tissue without replicating and providing the means to avoid antibiotics. So this is going back to the beginning of the slides where the transformation, the spirochete has the ability to transform into the cyst to seclude itself through using these genetic phase and antigenic variations. So that physical seclusion is all about moving into exactly that response. And then it has this ability to evade the immune response when we're hitting it with many antibiotics, because it can go and hide in synovial, endothelial, and fibroblasts and macrophages and Kupffer cells and neuronal cells, until it has the ability to say, okay, I'm going to get started again and replicate and disrupt the immune system. So the bottom line is, because it has this ability to have this physical seclusion, once you have Lyme disease, once you got Borrelia, you will never get rid of it. It is always going to be in your system. And now that's important to understand when you're working with your patients, for them to understand that and for them to know that it's going to be management of their immune system for the rest of their lives. And if you can keep your immune system in top shape, you're going to be good, you're going to suppress it, because your immune system is still much more powerful than a spirochete. So this physical seclusion in culture, Bergdorf, can be grown in fibroblasts for 18 weeks. So that's just giving you an example of some research. And that suggests that the organism can thrive over long periods of time in the right place, under the right conditions, and basically you can never get rid of it. So it engages in cloaking mechanisms by binding to proteoglycans, collagen, plasminogen, integrin, and fibronectin, thereby making it invisible to the immune system. Very, very clever. So what are the proposed mechanisms of Borrelia persistence? And they're really split into two. It's the active immune suppression and then the immune evasion. And it's those combinations of those two, and exactly what we've just been speaking about. It's about the complement inhibition, induction of anti-inflammatory cytokines, and tolerizations of the lymphocytes and monocytes when it's injected into the system. And then it's about all these genetic conversions and the mutations and the variable expressions of the antigens. And then the ability to, again, move into the cyst-like formation to hide away, move away from the immune system, put itself into the dark cupboard until it's ready to come out and move again. So if you bear that in mind, you're going to understand then how we help patients with Lyme disease, because it all comes down to looking at all the other systems that can help the immune system to optimize. So if we get that in our mind, then the treatment part is going to be so much easier. Then let's look at the final factor of why the spirochetes are just so damn clever, and it's because the secreted factors that they produce further disrupt immune function. And this is so impressive, because what they're able to do is they are able to release adhesin and porin. And these are two proteins that allow bacteria to adhere to cells and pierce the cell membrane to gain entry. So it's again about overloading the immune system so that the immune system is going, there's so much to fight, I cannot keep up. And then these spirochetes are able to thrive and take over. So it's creating this environment of disruption again through these secreted factors of adhesin and porin. So again, just very, very clever how they tend to do these. And they also have these pheromones that they can produce called quorum sensing, which is also secreted by mycobacteria. And it's another strategy that they've pulled into their system along the way, which helps them to survive and thrive along the way. So the next thing to think about is just with these spirochetes, what they tend to do is what they consume is they consume your tissue. So they primarily consume collagen, and along with collagen and disrupting your immune system, zinc, manganese, iron, and magnesium become deficient. And this creates a host of problems for a number of reasons. And one of the main reasons, these are critical for the immune system and the mitochondria and many other situations. But these four main elements have been seen with Lyme disease patients to be very deficient. And you can explain that in many different ways. Main one to explain is the destruction or breakdown of collagen, because that's what the spirochetes, the Borrelia, is eating. And that's going to be significant clinically now when I show you the associated conditions with them. And then because the immune system is so suppressed, the zinc, manganese, iron, and magnesium are consumed in abundance as well. So very, very interesting on how Lyme patients become completely suppressed. Their body really goes to a breakdown level because of all these different mechanisms happening at the same time. Now, mitochondrial dysfunction in particular, we got to remember that superoxidized dismutase 2, the cofactor is manganese. So when a spirochete is consuming manganese specifically, what it does is it reduces the oxidative pressure, the oxidative enzymes in the mitochondria, rendering that mitochondria now vulnerable to oxidation. And with the mitochondrial dysfunction at its peak, the body doesn't have the energy to produce more immune responses, and hence that spirochete, the Borrelia, can then take over further. So again, a vicious cycle of what it does there is by just creating this deficiency in certain enzymes that systems are needing, and then that again creates a vicious cycle for the Borrelia to thrive again. So Borrelia spirochetes induce mast cell activation and cytokine release. So this again is just exactly what we're talking about. If that immune system is heightened up, that the mast cells are just spewing out more energy, histamines through the roof, we're getting all these reactions, inflammation sky high, it's the perfect environment for them to thrive as everything gets depleted and broken down and confused. And we know mast cells are so when they are initiated like that, create so many different responses in all the different systems of the body, from the GI to the cardiovascular system to the neurological system, respiratory, the skin, and so on. You're going to see all these different systems or clinical signs and symptoms throughout the body. And that creates further confusion because of that ability to upregulate those mast cells, that then confusing the clinical signs and symptoms, because there's so many, on what is the appropriate action to take. And what tends to happen with conventional medicine is we give them another antibiotic, some more anti-inflammatories. It messes up the gut further, it further down-regulates the mitochondria, it increases the toxic load, and again, we allow the Borrelia to survive and thrive further. So this is another study that I think is just so important, because the damage from collagen and elastic fibers by Borrelia is really them consuming those fibers. And when they consume those fibers in more abundance than those fibers can be built up, and collagen is the fastest repairing tissue in the body, we've got to start to think about a few things. And here's some clinical pearls. So I really want you to think of some conditions that may be associated particularly with Lyme disease, but treated on their own, such as POTS, postural orthopedic, postural orthostatic hypertension, migrating arthritis, fibromyalgia, chronic pain syndromes, cramps for no reasons, particularly in the calves and the feet during the night for no specific reason. Now, what you can do with those patients is just try and identify if that is a specific breakdown in collagen that is creating all those signs and symptoms. And the way to do it is to give them a good dose of Regenemax and collagen. So if you use Zymogen's Regenemax along with a good collagen support, and they come back and they say to you, wow, within say 48 to 72 hours, they say to you, wow, you've cured me. You can basically say, I didn't cure you, I managed your symptoms, because now I understand that it's all about managing the balance of your collagen breakdown and reformation. And when they go through these bad spells of POTS and joint pain and neuromuscular skeletal symptoms of chronic pain and cramps, it's all because of that breakdown is greater than the buildup of collagen. So we can just use those simple tools to be able to understand that, yes, okay, we're in the right direction of our thinking, that this is a collagen imbalance. And we do know that Borrelia consumes collagen in great rates. That's how it thrives and survives. And then it's about understanding, okay, how do we get re-control of this Borrelia? So here is the cascade. Once we have a Lyme infection from a tick, we get decreased immune response. We get candida that flourishes, and just general gut dysbiosis becomes worse. And we know how that can create more flourish of oxidation and inflammation, which is going to further create mitochondrial dysfunction, more GI tract. And what do we tend to do? We give more antibiotics, and that impairs the microbiome further. And you start to get this cascade of immune system, mitochondria, GI tract, and microbiome being a mess. So how do we assess for Lyme and associated imbalances? We need to be able to assess the immune system. At what point is that immune system? Is it completely tipped over? Is it in the early phase? Is it in a chronic phase? And I'm going to go through that now. We need to assess gut function and food sensitivities. Now, I'm not going to dig deeper into that because that's separate talk, and we can go for a long time talking about that. But I want you to understand that that's a critical part of understanding Lyme and all the associated imbalances that it creates. So we need to do CSAP, we need to do food sensitivities, you need to do all of those gut function tests. Then we need to check the mitochondrial function. Organic acid is a great one to check from that side. We need to check for oxidative stress and inflammation. Critical to understand where is that point, because that's going to be a measure of our success as we start treating those patients. Check fatty acid profiles, because we need to make sure that that cascade of omega-3s and omega-6s are very well balanced to help with that inflammatory cascade. We also need the cell membranes to be as optimized as possible. Otherwise, we're just going to keep getting further stress throughout the body. So let's have a look, first of all, at the immune system and how do we assess for what is going on with the immune system. And one of the best ways is to use the Western blot. Now, ideally choose a layer that tests for all the species. And what we need to look for is to see what is coming back with that. Now, often this can be not conclusive. In other words, we may get a negative when it comes to all the Lyme screening tests, but then you may have to go and just look at the total picture of the patient, look at all the clinical signs and symptoms, and then have a look through each individual one and just mark off and understand if there are those odd rare ones that are popping up as far as the IgGs and IgMs. Because that may still paint a picture that there's immune dysfunction, but it's in a different phase at the moment. So the Western blot is a confirmatory test for Lyme disease in certain situations, not all the time. And there isn't one single test that we can use. And that is why the clinical reasoning that we use for a Lyme patient needs to definitely be more from a functional medicine side, where we're gathering all the information, putting that together and using our clinical reasoning to say, okay, this is more than likely Lyme disease because we haven't got something specific. So I'm talking about those cases that you haven't had erythema, migraines, you haven't got all the classical symptoms, all your tests are in line. You can't say it's definitely not Lyme disease. You've got to look at the bigger picture. And that's why nothing is definitely conclusive if you don't get a pure positive Western blot. Now, the next two parts of the immune system to assess are C3a and C4a. And these findings suggest from many research papers, but this one particularly, that C3A and C4A may be useful markers of Lyme disease. And they can be in different aspects. So as far as acute and chronic, and we're going to dig deeper into this right now. So there's a new test option, and we're going to look at the C3A, which measures the degree of inflammation due to bacterial membranes, C4A, which measures degree of inflammation due to biotoxin, and then TGF-B1, which measures your immune suppression, and then CD57, which is a measure of your natural killer cells. So this is an example from Dunwoody Labs, where we're able to use an algorithm from those four and help us understand, is this more of an early Lyme disease, a chronic Lyme disease, or is it mold? And it all depends on how these things come up. So what it's really shown us here is all patients with chronic Lyme disease and with HIV had normal C3A levels. So that's on the chronic side. Patients with predominant musculoskeletal symptoms of Lyme disease had normal C3A and increased C4A levels. So those are chronic patients. And this pattern differs from the increase in both markers seen in acute Lyme disease. So acute Lyme disease, we've got C3A and C4A that are both high. Chronic, C3A is normal and C4A remains increased, and that's the big differentiator. Now with TGF-beta1, it is slightly different. And what I want you to do is just to understand, first of all, what is the norm for TGF? And ideally, you want to see something below 2400. Now, as soon as it starts escalating, that is when we know there is an issue. So understanding what TGF-beta1 does is it turns on all the reg cells. It increases production of Th17, which is involved with autoimmunity. It regulates Th1, Th2, and Th17. So that is the basic response to understand that it's very involved with heightened immunity. And what it's doing here, this is just really showing you how the pathogenic effector T cells increase TGF-beta1. Now CD57 lymphocyte subset may be an important marker of chronic Lyme disease, and changes in CD57 subset may be useful to monitor the response to therapy in this disease. So this is what this research paper has really come out, just to tell us that CD57 is an important marker for chronic Lyme disease. And this is where the whole algorithm between the C3A, the C4A, TGF-beta1 and CD57 comes in to understand the immune responses at different phases between acute, chronic Lyme disease and mold. So what we see when we bring all of that information together is that with early Lyme disease, C4A and C3A are high and CD57 is low. When it comes to chronic Lyme, C3A goes back down to normal, but TGF-beta1 is down and CD57 is down, while C4A remains high. Now in mold, it is a little different because C4A remains high, C3A drops down, and TGF-beta1 is very much up, closer to that 10,000, between the 5 to 10,000 mark. And CD57 remains normal. So this is the classic algorithm now being used, and Dunwoody Labs have got that test down to a T to be able to put all of these together and be able to say, okay, where are we at? Is it mold? Is it Lyme? And is that Lyme now moved into a chronic phase, or have we just picked it up and it's early? So here you can see, this is probably not as clear as it should be, but you can just see in this factor what it's showing us are C4A levels that are high, TGF-beta levels that are super high, and then you've got C3A that is low. So this is actually a mold case, and that's where we can use this to differentiate the two. So what are our treatment goals? Now that you've understood the pathophysiology, all the clinical signs and symptoms, the complexity on the whole, the first thing is to decrease that spirochete load. And that makes complete sense. Like, what can we do just to get rid of as much Lyme in the body as possible before it goes into cyst formation and hives? The second step is, what are we going to do to bind and eliminate all the toxins that are released from killing off all the spirochetes, killing off all the other co-infections, remembering that was the number one reason for Lyme patients not getting better. And we need to be able to kill off everything at the same time, because the spirochetes have allowed for this co-living area of all these different bacteria and viruses. Then we need to support the immune system. So as we're killing everything off, we need to support that immune system so the immune system can respond and manage to Lyme in the long term, because we're never going to get rid of it. And then support and rebalance inflammation and oxidative stress. Remembering that most Lyme patients are going to have gut issues, oxidative pressure, their mitochondria is going to be struggling, their liver is going to be burdened with all the toxins, and they've probably got some neuroinflammation. So there is this mass of inflammation, oxidative stress that needs to be supported and rebalanced. Then we need to support the mitochondria and detoxification as the body continues to heal. So these are some of the protocols that we use in our practice, and we've had tremendous success with them. And we've been using products by Panacea, and the one is called Lymex. So this is when we're going to get the spirochetes under control alongside all the other co-infections. So these are very, very powerful herbals that have anti-spirochetal, antibacterial, antifungal, antiviral, immune enhancing characteristics. They're anti-inflammatory, antioxidant, they support the liver, and it's all about just decreasing that spirochete load. So typically we would use 3 specific products. One, Lymex, and we will start with that. This will be the protocol that we would use. Is in the first 4 weeks, the first month, you're going to use the Lymex twice a day. You're going to use that alongside the AVAT, which is antiviral, and you're going to use 4 caps twice a day. In the second month, you're going to change that around. You're going to continue with the Lymex, doing 2 twice a day, and you're going to use the anti-biobotanical, and you're going to use 3 of those daily. Then you're going to alternate the AVAT and the anti-biobotanical based on the patient's results as they've gone through. So what you're going to ideally do is flip back to the AVAT in the 3rd month, and then in the 4th month you can go anti-biobotanical again, and you're going to watch the MSQ scores and see what is happening as you're in touch with them on a daily, weekly basis. You're going to start to understand, okay, we had a massive change from the AVAT and the Lymex, or we had a massive change from the anti-biobotanical and the Lymex, and you're going to decide which one to continue with if you're not just keep alternating. So very good protocol that's really, really worked well with many of our patients. Now, these aren't the only supplements we're using. This is the core or the foundation of everything moving forward. So what we're going to understand then is, as we kill off all these spirochetes, there is going to be the body's burden of toxins. And we've got to think how to overcome that. So there's many different options here. We particularly like Optifiber Lean from Zymogen. So it's got the glucomannan fiber. However, you can use many others from your activated charcoals. Use those 2 hours after and before meds, foods, and supplements, so it doesn't bind at all. Use the bentonite clay, zeolite, chlorella, modified citrus pectin. So you've got all those different options to use to just bind and eliminate toxins. As those patients are able to walk a little bit more, exercise a little bit more. That's going to also help to get rid of toxins and detox them. But you can't give them too much stress, too much burden on the body by saying, okay, you need to go do, walk or run an hour a day. That doesn't work. These are chronic, difficult patients. We've got to take a step back and we've got to slowly build them up. So we've got to use these other mechanisms. We've got to make sure they're eliminating their bowels properly. We've got to make sure that they're sleeping well. We've got to make sure that they're in a good environment, that they're not stressed, so they can eliminate better and better. We really need to all the time be thinking of Herxhema reactions, because we're going to be treating the gut at the same time. I'm not going to be going through those gut protocols specifically with you now, but you're going to need to change their food plan, and you're going to need to expect something to come up as far as Herxhema reactions. And Herxhema reactions can be dangerous, and they should not be discounted. We need to be thinking of everything. Now, your OptiFiber Lean is going to be a good binder, but you're also going to need other things like Alka-Seltzer Gold. You're going to need some vitamin C or some glutathione. You may need some strong curcumin. We'll use Zymogen curcumin 95, Curcuplex 95, twice a day, just to take that inflammatory burden off. So these are just all the other possibilities during a Herxhema reaction that you can use. I'm not going to run through all of them there now, but this is really an exhausted list. So the next level is about supporting the immune system. And, 3 basic supplements just to help the immune system are going to be the mushroom immune complexes, and a lot of brands have got some really good complexes to help support the immune system with the mushrooms. So have a look at those. Zinc needs to be at the best level. Always use a zinc glycinate. And then look at good probiotics, whether you're using spore probiotics, or we really like the Probiomax SPDF, which has got the Saccharomycin boulardii and some other very good base flora in there, as far as the lactobacillus and bifidobacteriums. But the bottom line is, if we're going to support the immune response in the long term, we need to be optimizing the gut. We need to support detoxification. We need to rebalance fatty acid profile, and we need to reduce inflammation and oxidative stress. So that's like the third tier that we need to do, is to support that immune system. And we have to be thinking from a functional medicine perspective and how that web of interactions connect between the biological systems. So we've got to be thinking not just from the perpetuators and the triggers that are in their lives, all the lifestyle factors, but we need to be thinking of how the mitochondria works with the immune system, how the gut is connected, how the mental, spiritual, and emotional areas are connecting to all of that. And then you're just going to get much better, quicker results. Don't forget about the mitochondria. And this is why it's so important to do an organic acids if you do have a Lyme patient, so that you've got something to measure along the way. CoQ10 and vitamin C, so vital. Vitamin C helps to recirculate CoQ10. And often with these patients, their levels of vitamin C are really, really low. And we'll use up to 1,500 milligrams 2 to 3 times a day to help just to restore not just the antioxidant levels of vitamin C, but to help that CoQ10 recirculate for the mitochondria. Carnitine, so needed to get all the right nutrients into the Krebs cycle. NADH. And NADH, you can use a very good product called Triagen, which is a formulated NAD product. And yes, so we've seen really good success with Triagen as supplementing with NAD for those patients. Magnesium, very key. Vitamin B complex, these are all supporting the Krebs cycle, and amino acids. And again, if your patient is struggling with their gut and they're not processing properly, then they're not going to be absorbing the amino acids. So we have to start with just doing a betaine hydrochloric acid test. see if their stomach acid levels are at the right level. If they're at the right level, yes, then we're going to have some form of amino acids being absorbed and getting to the Krebs cycle so we can produce enough ATP to help restore function of the body. So that is the end of Lyme disease, as we know it. So if you are using those principles, you're getting that all right, you're understanding the pathophysiology, you're understanding the connections of the biological systems with what Borrelia does to the immune system, understanding how it digs in to that immune system, hides away, and then suppresses it, how it uses secretory factors to bring in other bacteria to invade the immune system, create this inflammatory cascade. Know that it feeds off collagen and all the minerals. And that's why we have this coexisting conditions alongside Lyme disease, such as POTS and fibromyalgia and chronic pain and all the arthralgias. So just understanding the complexity of what it can do will help you to understand how to fix it. And then what are the right tests to go through there, as we went through, to identify what is the possibility of this patient having Lyme disease. Because it's all very well if that patient comes out with all the tests saying, yes, it's in the right numbers. But if they're just off, or they're just not what you expect it to be, but everything else seems to be right, you have got to put the clinical picture together to understand, yes, there's a strong possibility that there is a spirochete invasion. The Borrelia have taken over here and we need to suppress them. And now you know what to do. So I hope that makes sense. Keep it simple. Understand what Lyme disease is and what it does. And it's going to be easier to be treating your patients.